Hello, my name is Fred Trotter. I am a healthcare data journalist with CareSet, and I am helping with the streaming booth here at Health Datapalooza 2024. Thank you so much for joining us. This is a fascinating panel on future catalyst, redefining investing in the next health innovation. What brings you to Health Datapalooza?
So I'm Judy Monroe. I'm president and CEO of the CDC Foundation, and I'm here because data is so important. We support the Centers for Disease Control and health departments, and so I'm most interested in advancing the system. When we look at data modernization and the initiative there, that is critically important. I'm here as a philanthropy that helps raise funds, and to me, the holy grail is that we build for our nation the data system that we really need to enhance public health and coordinate, have that real-time data to be able to take actions as need be. So that's why I'm here.
My name is Lina Walker. I'm Senior Vice President, Global Thought Leadership at AARP, and I am at Datapalooza because data is what drives the work at AARP. We serve as a bridge and we are a catalyst, and we use data and the evidence and information so that we can share and learn, and we can use that to advocate and champions for people and their families.
I'm Stedman Stevens, Galt Healthcare Consulting. I'm here at Datapalooza because data is so interesting and fun. And if we can modernize it and utilize it and access it, we can improve health and life.
So thank you so much. People don't know how innovative the AARP has. And it's funny because there's so many things that I have seen AARP taking the lead on senior tech and these kinds of things. So welcome. I got to be honest, I only learned a few years ago that there was a CDC Foundation. But ever since I've learned, I've been so enthralled by it. And, I really appreciate your enthusiasm for data. That's amazing. You are all welcome here. And it's so obvious why you were invited and why you were great speakers. With that in mind, are there specific data sets that you're excited about?
I can share if I may. So during the panel, I talked a little bit about the collaboration we have with the University of Miami in Ohio, building the nursing home COVID-19 dashboard. But one of the things that we learned during COVID was where the gaps in the data was. And there's actually it's very difficult to get really good handle on racial information. So the two data sets that we're building at AARP is the disparities dashboard. We're partnering with the Urban Institute, and we're going to start collecting information that can shed light on some of the determinants of disparity and have information that is geographically diverse so that we can look for local interventions that can help support sort of more equitable solutions. The second one is that it's just been really difficult to get disaggregated data and information on the Asian American, Native Hawaiian, Pacific Islanders. And so we have partnered with NORC at the University of Chicago, and we have built and launched a research survey panel that is focused on the Asian Americans, Native Hawaiian, Pacific Islanders, so that we can have more survey questions and understand that community and that population better.
Yeah, I would agree. I mean, the disaggregated data, the more that we can have the granular data from our communities and the various populations, that's of keen interest to us at the CDC Foundation.
We're taking a look at what the data is out there. On the panel, we talked a bit about we need more workers in healthcare and the workforce and status and nurses particularly. And when you look at it, there are different reasons that people don't graduate. And so we took a hard look at those data sets in the university setting and the community college setting and realized that retention rate locally and also graduation rates were very different in a university setting versus a community college setting because the students are very different in their motivations and their needs. So one needs daycare and scholarships, the other needs an internship. And so ours is more on interpretation and utilization, evaluation of data.
So obviously, I'm so sorry that I missed your panel because it was obviously good. I can tell it was good. Do you have final thoughts for our streaming audience?
I'll jump in. One of the things I shared on the panel was the strategic triangle. It's something I've used throughout my career. I learned it actually at Harvard when I was a new health officer in Indiana. It's written by Mark Moore and some of his colleagues at Harvard. And the strategic triangle has, of course, 3 points. One is creating public value. Another point on the triangle is operational capacity. And the third is legitimacy and support. And I've used those 3. I think any project that you're entering into and partnerships, you've got to be true to what's the value that you're creating for the public. You've got to obviously have the muscle to be able to operationalize and to deliver on. And the legitimacy and support comes from the legitimacy from your leadership. I mean, if you're appointed by a governor, you gain that from your governor. Legislators, policymakers all need to see that legitimacy of what you're trying to do. But the resources come from there. So that's where the money comes, whether it's whatever source that might come from. If you've got all those 3 working together, you can really move mountains.
And I would say that, for us to create a really vibrant, integrated community, an age-inclusive community, we really need to have all the different sectors working together. And the public sector, the private sector, philanthropy, and organizations like AARP. We each have our strengths. And when we work together and collaborate, we can each bring our strength and really we can do some lasting, impactful work.
I think building on both Lina and Judy's great comments, and I think if we're going to really innovate, we've got to look at it strategically. So we've got to figure out what's the big picture that we want to solve, and what are the root cause problems that we need to solve, and then drill down to the tactics and see what works best. But be open-minded to unusual things and different things, and embrace change.
I really appreciate you making the time to talk to us. So thank you so much for
Thank you very much.